And now it's my pleasure to introduce the Honourable Pru Goward, Minister for Mental Health, who is going to formally launch the Intellectual Disability Mental Health Core Competency Framework. Thank you, Minister.
Distinguished guests, ladies and gentlemen, it's a great pleasure to be here this morning to launch the framework, the Intellectual Disability Mental Health Core Competency Framework for mental health professionals. And I'd like to start, first of all, by congratulate all of you who have contributed to that framework. Of course, Professor Choller, we all acknowledge your great work, and I certainly enjoyed sitting down with you last week and learning a little bit more about what you do and how one should think about these very challenging questions. As Minister for Mental Health and Medical Research, I think I can say on behalf of the New South Wales Government how privileged, how lucky we are to have such a renowned international expert doing work in this very important area here in New South Wales. We all know the statistics, that up to 40% of people with an intellectual disability have experienced a mental disorder of some kind also. And sadly, the many burdens that go along with being intellectually disabled, including most significantly poor physical health and higher mortality. With over 135,000 people in New South Wales living with an intellectual disability, this is no small cohort of people. And it's those statistics that demonstrate the need to ensure our mental health service system is equipped for those with an intellectual disability, that the service system doesn't fall short of what is available to the general population. And that is why this government is pleased to support this work. And we recently announced $3.9 million over 5 years to continue a range of capacity building activities coordinated through Professor Choller here at the University of New South Wales, and are very proud to continue that partnership. This core competency framework is actually, and I had to say in the car, I expressed my deep shock at this, this core competency framework is the first of its kind in the world. How can, with all that we know about intellectual disability and the linkages with mental illness, how can it be the first? But it is. And I think it's a very important outcome of the strength of this sector, the commitment of this sector, the fact that we have people like Julian Troller here in New South Wales, and I'd like to say our own commitment, the New South Wales Government's commitment to improving outcomes for people with an intellectual disability. We are very vain about always wanting to be leading Australia and leading the world, and I'm delighted, although in sorrow rather than anything else, to be able to say that this does ensure New South Wales leads the world in this field of study and its translation into practice. Good. This framework will most importantly help our clinicians working with people with an intellectual disability and mental illness, along with their families, as Beth has said, their families and carers. It will give our dedicated workforce the confidence and the skills they need to deal with this very important cohort of people. I think it will reduce the load on our health services, particularly, of course, those with an intellectual disability who present so often unnecessarily to our emergency departments. And most of all, it will improve the lives of people with mental illness and intellectual disability, their families and their carers. So the principles of this framework are based on developing a more responsive system, working together to deliver that person-centred care. These principles are also consistent with the government's approach to disability services over many years, with Stronger Together and now the NDIS. These principles are also central to the New South Wales Government's decade-long whole-of-government enhancement to mental health care. This government invests $1.7 million into mental health, and the early years of new reform are now being delivered through a $115 million boost over the next 3 years to mental health funding. In fact, we're halfway through that boost. We've been working very hard to create the building blocks of reform to shift the balance from hospital to community-based care. We have invested significantly in reform so that people with a mental illness and intellectual disability can live a better life. The task of government is to make people's lives better. We are doing this practically through, firstly, putting a greater focus on community care, enhancing community living supports, delivering more mental health and social supports to allow people to live well in the community. We're also strengthening our community-based mental health services, building our community teams. That will allow more people to be treated closer to home and to stay out of hospital. We're also delivering a system that embraces more partnership. It's through partnership with the non-government, university and community sectors that we will be able to provide what we all dream of, an effective, seamless, integrated care. Care that is centred around the needs of the person, not of the system, and reflects a whole-of-life view of health. And that is what I think is the fundamental holy grail of social policy today. How do we bring health and other social services closer together to not only deliver better health or housing or child protection, social outcomes for vulnerable people, but to break disadvantage, break intergenerational disadvantage, and to close those service gaps that inevitably lie in the lives of people with complex needs. So the challenge for governments, for policymakers, for service providers, for mental health carers and consumers is how do we do that together? How do we break down those great big silos? How do we work together to partner like we've actually never had to partner before? Because this is what the 21st century model of care is all about. Integrated care that takes a whole-of-person approach to complex needs. It has to be person-centred, connected and effective enough to improve not just the health outcomes, but the social outcomes, along with quality of life. So good policy relies on the involvement of all sections of society, not just governments. And the innovation requires us to work together. That way we optimise the talents and skills of all of us and how we use them. It means we bring a combined and very special force to bear on these problems. And we have to remember governments never could and never would be able to solve these problems alone. It wasn't even true in the Soviet Union. It certainly is not true here. It takes a community to support people with complex needs, to break that disadvantage. So this partnership between 3DN, the university, and the government is a great example of the necessary collaboration required to achieve effective integration between, for example, health and disability services. We need to see more examples of university and research institutes working together with government and non-government sectors to help solve complex health and social problems. We need in particular to see that work translated particularly practically to our acute and subacute mental health wards, our emergency departments, our NGOs and the wider health system. So a call to action, a challenge to you, to those who work in mental health facilities, who work in mental health policy, which includes those with intellectual disabilities. Take the opportunities to use this framework in your services and institutions and for your own professional development. One great positive of this framework is the fact that it emphasises practical implementation of its guidelines. We can always do with common sense. It is not just to be left on the shelf. So then, become familiar with the 10 attributes from the core competencies which highlight the skills required when working with a person with an intellectual disability. Do you have them? Can you develop them? How will this framework assist? Use this framework when working with those with a mental illness and intellectual disability. And I challenge you to look deeply into your own professional practice. You need to perhaps change it. Do you need to change your communication style to meet the patient's needs? Have you identified your patient's support network? Do you work with that support network in managing care? Do you seek support and guidance from intellectual disability specialists to improve your clinical knowledge? We never know it all. They are the challenges, and that is what this framework and today is about appreciating. I understand that many of you will, I think, be participating in a workshop that certainly takes us through those key points. And ultimately, it is the people receiving mental health care who will benefit the most from your professional skills, your commitment to providing the best possible care, your sense of mission, and your appreciation and application of the framework that is the subject of today. So again, I'd like to congratulate you all for being part of this launch today, and congratulations again, Professor Trollo. I'd like to encourage us all to keep breaking down those barriers in our minds, between agencies, between sectors, because people with intellectual disabilities certainly face them in our health system. We need to remember our society is only as strong as its treatment of the weak. A chain is only as strong as its weakest link. So thank you, and I look forward to the very best of your